we'll connect you.
Now, this is such important information because, of course, diabetes, particularly type 2 diabetes, is at an all-time high and growing at an alarming rate, and it's called an epidemic, which to me makes people think that you're walking along and you catch it, which is not the case.
Well, yeah, it's also because the underlying cause of diabetes has been largely ignored, or the condition that precedes the type 2 diabetes condition has been largely placed below as a low priority, and that's insulin resistance. And that is the condition where, despite the fact that your body is putting out insulin to meet the carbohydrate glucose load that you are putting into your body by eating the regular diet, the body's not responding, and the blood sugar levels are not coming down. And over time, there's a great one of the great doctors who is turning this around, treating diabetics effectively. You have the type 1 diabetic, Dr. Richard Bernstein. He's fantastic. There's a doctor in Canada named Jason Fung, who's a nephrologist, who literally has turned type 2 diabetics around through supervised, monitored diet and intermittent fasting. Basically a program of getting type 2 diabetics resensitized, getting their bodies resensitized to insulin by changing what they eat and when they eat. And that has had profound positive healing effects. I mean, he's documented. There's a great blog called IntensiveDietaryManagement.com. I highly recommend that to the audience to take a look at. All of the success stories are there. I'm talking about stories of people who have been injecting for many years insulin as a type 2 diabetic, and going under Dr. Fung's treatment, putting their condition in reverse and either eliminating medication or dramatically reducing it completely. Now, you would ask, why aren't we paying attention to this? Why is it when somebody...
So wait a minute, I'm the one who's going to ask. That's just what I was going to ask. Yeah. Why is this not part of mainstream intervention?
Well, you have to. I believe, this is my opinion, it's a double-edged sword. On the one hand, you have a lack of knowledge of clinical and metabolic nutrition on the part of the medical community. Why aren't medical doctors, medical students being required to take as much clinical, therapeutic, metabolic nutrition as they are being taught pharmacology, number one. And then number two, there's no incentive on the part of the pharmaceutical industry to focus on this. Sadly, the dark side, there's a saying, is the pharmaceutical industry is interested in having lifelong clients. They don't want to cure. When was the last time that we cured a disease in this country? When was the last time the pharmaceutical industry came up and went to FDA and said, FDA, we have a cure for X disease or Y disease? When? And when you think about it, it's really shocking. We have a Baskin-Robbins, literally, but no pun intended, pharmacy cabinet on how to lower people's blood sugar for type 2 diabetics. But there's nothing to get down to the underlying reasons why their sugars are elevated that high, and they don't even employ as a first line of treatment. Well, you know what? If your blood sugars are so high, stop eating the foods that raise your blood sugar. Stop eating so many carbohydrates and watch what happens.
Definitely not. They just talk about using a sugar-free supplement, a sugar-free substitute with toxic sweeteners muffin.
Yeah, well, but even the muffin is the problem in and of itself, because
exactly.
Carbohydrates all become sugar in the body. That's the end product of carbohydrate is glucose. And if you are type 2 diabetic or you are obese, your body can't handle the load that you are putting on it. So it would behoove common sense, logic, and reason. Stop the assault that you're doing. And sadly, people, have for some people it's very difficult. When I tell people that, I don't eat rice anymore, or I don't eat bread, they look at me and they go, "Wow, I couldn't do that." Or I haven't had, a bowl of cereal. I think the last time I ate anything, I had a bowl of coconut flakes. I had these paleo flakes that were terrific, but they were made from coconut, not from corn or oats. And this is the things that got to check. Grains and sugar raise blood sugar very high, and the body has a hard time with it. And you have a situation where we now have half the people who have or type 2 diabetic or predisposed, and this is the crisis that we face.
50%. Yeah. That's outrageous. And I think a lot of that is because, like what you're talking about, the testing itself is not necessarily accurate if they're only testing blood sugar, or
right,
rather than just looking at the insulin.
You have to test both. And there's a great doctor by the name of Joseph Kraft. He wrote this book called Diabetes Epidemic in You, and he's been interviewed by a good friend of mine from Ireland, a brilliant biochemical engineer named Ivor Cummins, who is he has a website which I also recommend to everyone called thefatemperor.com. Ivor is one of the most intelligent people I've ever met, and as an engineer, his thinking and approach is systems, root cause analysis, and solution. He looks at an entire system, identifies what's the problem, and then looks at how do you address the underlying problem to reverse and correct it. We need more engineers in medicine, or more engineering thinking. But getting back to Dr. Kraft, and on the fatemperor.com, you can see the interview with this great man, this Dr. Kraft, where Dr. Kraft actually studied not only the glucose tolerance, but he saw how their insulin levels responded. And he discovered that there were 4 different responses in the subjects that he studied. And only one pattern, which he calls in his book Pattern 1, was of a population that had a truly normal blood glucose, blood and insulin response. The other 3, he was able to show there were abnormalities because of the amount of insulin that had to be secreted to bring the blood sugar load down to a normal level. And it gets technical, but I recommend this book to everyone. And I would make the argument now you have actually an intelligent way to start looking at how to prevent and also treat and reverse diabetes. This is the way. It's not enough to get a glucose tolerance test. You need to get that 5-hour glucose tolerance test with an insulin assay. Now, not everybody's going to do that, and not every doctor.
Let me ask you this: if people ask a physician, perhaps, to go a little more deeply and perhaps do an insulin assay, is that something that's often covered by health insurance?
Yeah, yes, it is covered, but you have to be smart when you engage your doctor, because you have to say, look, if I have all these risk factors, I have metabolic syndrome, and the end stage metabolic syndrome is revealed in type 2 diabetes and coronary heart disease. And so this is what you're saying to the doctor. Look, I need to know how my body is handling, my insulin response. That's another test, everyone. You should find out what your fasting insulin level. If that number is high, if it's above 5, that's a number that should be a red flag to you. You want to keep that fasting insulin level down, especially if you're normal. If you're type 1 diabetic, you don't have the insulin you have to inject. But for everybody else, there is beta function in the pancreas, beta cell function, and there's insulin. And you need to know what is your body doing on a daily basis in order to keep the blood sugar in control, the homeostasis of glucose in the body. So yes, you ask your doctor, but you go one step further and say, Doc, I want to know how not only, how I handle a glucose tolerance test, I need to know how much insulin my pancreas is putting out. Why? Well, here's scientific data, or here's Dr. Kraft's book. If I'm not in these ranges, then there's something I need to be doing right now so that my situation does not evolve into full-blown type 2 diabetes or into coronary heart disease. And so, as I said, this biochemical engineer, my friend Ivor Cummins, says, insulin is the bus driver of all of this stuff, because insulin is a very powerful hormone. Insulin is anabolic, which means it builds, it creates, and it stimulates. If you have a lot of it running around, and it doesn't have, and it's not being signaled or processed correctly, it's going to begin to wreak havoc in other ways or reveal itself in other ways. And it's you can't live without it. But at the same time, we really need to spend our time and research on this, because the underlying root cause of heart disease and type 2 diabetes is insulin-related insulin resistance / insulin resistance. And I say that with the caveat that I'm not a medical doctor and I'm not a scientist, but I feel fortunate that I have come across some very brilliant people who understand this and are employing this in their clinical practices, and they're talking about it. And there's a wonderful doctor in Colorado.
And you have made the effort in your personal life to create this change, and you have personally seen how much it can do. And I do want to tell listeners that you are listening to Mr. Tony Martinez, who is the guest today. He's talking about a lot of issues, and currently we're talking about diabetes and the fact that he was able to basically reverse it by using what's called a ketogenic diet. He's giving you great tips. There's a book called The Diabetes Epidemic by Joseph Kraft, which has a lot of information in it. And Tony, let's talk about your personal, what has changed in your life since you instituted some of these things. Of course, you have to be willing to make some changes, like not eating sugar or grains.
Right. I want to acknowledge, because I know people wonder, who are the doctors that know about this?
Right.
And I can give you, in Colorado, there's Dr. Jeffrey Gerber. In North Carolina, there's Dr. Eric Westman. And there's a whole others. Dr. Ann Childers is another terrific doctor. There's a whole cadre of health professionals who are really out there, who really have a handle on this and are really blazing a new trail here, and really are going to transform the healthcare system on this country and around the world. And there was a very important summit of the low-carb, the high-fat community under Professor Tim Noakes, Noakes, another very distinguished scientist who really has a handle on this, and I would recommend that to the audience. Now, just getting back to me, what changes have come to me? Well, I'm back in my suit size from college days, happily so, when people look at me like, what are you eating or what are you doing? And, I just am like, I don't, I just avoid, no grains, no pasta, potatoes, or sugar, GPS. It's basically is that. Does it mean that everything's perfect? No, it means I have to keep an eye on all of these things, because I'm, I have insulin resistance, and I have to make sure that I'm doing things to keep that in check via exercising, via intermittent fasting. Sometimes I'll eat only once or twice a day, and not out of because I'm starving myself, since I'm not hungry. And keep by and,
But that's
and by
very big. A lot of people feel like if you did make this kind of sacrifice and just don't eat wheat, that's a good, very simple place to start. I mean, you've gone beyond that.
Well, it's
that they'll be hungry, and yet you're finding, in fact, you're less hungry because you don't have those sugar cravings all the time.
Right, because I'm a fat burner. Because I'm keeping my body metabolically to burn fat. Because by deduction, I'm just saying, look, my body doesn't burn carbs correctly. Well, for whatever reasons are, and so at its most simple, I'm not going to aggravate that process anymore, or delude myself to thinking if I take a pill, I can go have a vanilla malt, at Baskin Robbins or something, or at an ice cream shop. I can't do that. But what do I get to do? Well, I get to eat, a nice juicy steak. Or I was at a Spanish restaurant in Miami, fantastic place, and they have a real fantastic Iberico ham. Had a plate of that with manchego cheese and in a glass of wine, and that was fantastic. And so you can get creative on this. You can eat good food. The idea is to eat real food, and it's basically some type of meat, seafood, and not overdoing it, because excess protein will be converted to glucose. That one of the miracles of life and nature is the liver as an organ. When you begin to understand what the liver does, it is you really marvel at nature. As your liver will take excess protein and convert that into sugar. So your liver will convert whatever you're putting into it either into glucose or into ketones. And the ketones come from fat. And ketones do not require insulin, whereas glucose does. So if you're obese...
Now wait, let's just talk about one thing. What about the wine? Wouldn't that tend to convert to sugar also?
Well, I have just, there is demonstrated benefit for the heart in that of some alcohol. It's a very narrow window. It's basically because of us having one glass of wine, 2 at max, and not overdoing it, and not overdoing it every day.
Okay, so that would be something you would consider like a little cheat, maybe, but
it's not as a cheat. It's just something that you have to find out what your zone is, so to speak, because everybody's different. Once you start healing and recovering, your tolerance for carbs or whatever may improve. In other cases, it may not, and you have to. It's really a journey of discovery, and that's really how you have to look at this, because your body is unique. It's not exactly the same like somebody else's, and you have to experiment and see how your body responds to food and different foods. So I know, like, if I were to eat a piece of toast, my blood sugar is going to go boom. I've tested myself.
Okay, so would you still say you're a diabetic then, or have you actually been, cured of that diagnosis?
Well, I wouldn't say no. I'm not cured. I have it reversed and managed. I have a normal A1C, and that's why you listen. I cannot, and I will probably never go back to, ice cream cones and big plate of rice and beans, or whatever, the high carb. When I go to the movies, I don't eat popcorn. I eat a bag of nuts. Almonds or macadamias, those kinds of, you begin to learn, and that is how you change what what you're eating. And then you also get creative. I mean, the beautiful thing about this is you get to reinvent your kitchen and what you're eating and discover alternatives to things. Like, for example, you like potato chips, but potato chips are not on the menu or on the diet. Hey, Brussels sprouts. I had read this fantastic recipe, and you try it where you you flake out all the Brussels sprouts, and then you cook them in olive oil with a little salt, and you have this wonderful, healthier, low-carb equivalent.
And it's available in the health food stores, too, like they have kale chips and things like that.
Yeah.
Which gives you
Absolutely.
that mouthfeel of crunching on something.
Yes. Yeah, exactly. And not all non-nutritive sweeteners are bad. I mean, stevia is something that is, becoming more commonplace. And of the sugar alcohols, erythritol is the one that really does not raise blood sugar. So that's why you see that in that product Truvia that's out there. That's just a combination of stevia with erythritol. And you have to just get creative when you see something like, I love cannolis, but I can't eat a regular cannoli. I can't eat a cannoli that's made with sugar. So you learn how to make this stuff, and you start changing and exchanging the ingredients. You start, if you're going to bake, you start using nut and seed flours, and you avoid all the grain flours, because the grain flours just have too many carbs. And so this is how you change and you adjust. But the fact that, I'm not, on any heart medication, I take that back. I take an aspirin every day. But I wasn't on the pharmacy that I was given when I was discharged from the hospital after I had my heart attack. And, I was so happy when I left from my cardiologist, her response to me was, well, I only now need to see you once a year. Keep doing what you're doing. Take care of yourself.
Well, it is really inspiring, and we're coming to the end of the hour. I want to say that you also told us about another book called Serial Killers. That's with a C.
It's not a book. It's a DVD. It's a DVD, and it's available on Yekra, YEKRA.com. It's a $5 rental, or you can buy it, I think, for $20. It's fantastic. I would highly recommend it, and you'll also get to hear from some of the leading world authorities on this. Professor Tim Noakes from South Africa, who wrote a best-selling book called The Real Meal Revolution, and I'm looking forward to seeing that book being published here in the U.S.
Well, we got to end here because we're out of time and they're going to cut us off, but I do want to tell everyone that
being back on the show in the future and checking in, and it's really always a pleasure to talk with you, Ellen.
Thank you, Tony.
And I wish my best
to the audience show
here.
Again, or tell your friends, because it will be archived on Progressive Radio Network. And until next time, this is Ellen Kamine, The Natural Nurse, at naturalnurse.com, and Facebook, The Natural Nurse.